So my name is Kimber Rice, and I am a family member in the LEND program. Just acknowledgement for funding, and that that this information is not endorsed by first or the U.S. government. All right, so my program was LEND Advocacy and Policy Curriculum Study. So the purpose of this project was to gather information about the various models and practices of policy instruction across LEND programs, specifically in California. And through this process, the hope is to identify commonalities in instruction across sites, strengths and gaps that could then be possibly supplemented with the Family Voices of California Project Leadership Advocacy curriculum. And with this information, hopefully lead to a standardized framework for policy curriculum across the LEND programs. So I wanted to first take a step back at a national perspective to LEND, and that it is part of a larger network whose purpose is to advance policy and practice for and with individuals with developmental and other disabilities, their families and communities. And so with that thought in mind, that nothing exists in a vacuum, I really wanted to take a step back and look at the wider perspective of LEND policy trainings to get some good information about what it could look like. So I looked at 13 different programs across 5 states with information pulled from AUCD's Technical Assistance Center. And from that information from those various programs that I found, some was very in-depth. There was a syllabus with a lot of information about the details of the training, and others were just a summary. But from the varied information, I was able to find that represented here in the graph in the center are the 4 main topic areas that were covered in all the trainings. So those are the common areas. So healthcare issues, policy analysis, ethical implications, and the budget process of legislation. And then the outer circles represented by size are where the bulk of the training went. So seminars were by and far the most common form of delivery for this information, followed by some type of action plan or policy report from the trainees. And then across the programs, less time was spent on actual legislative visits of some kind, and then even less programs spent time on some type of connection with community-based organizations. So this is just the basic chart that I used to compare the programs, where I pulled the information and put it into something that I could then kind of really look at that information, and that's available for you if you'd like to see that later in more detail. So then from that national perspective, I did hone in on the California programs. So this is the kind of comparison between the 3 LEND programs. And the big difference was really on whether or not there was a project, and really whether there was any time spent doing legislative visits in some form. And so that's where the biggest variation was. And so when I was looking at the projects and legislative visits and that varied information, what I was able to extrapolate was a varied policy experience across the programs, and even varied within a program for individuals. And so the impact of the experience was either individual or group, depending on the program, and even the year. And then the research could consist of literature review, connections and interviews with community-based organizations, as well as activity doing a policy report. And then the results of that information then led to either observations in legislative visits or actual active briefings. And so there was a lot of varied experience even within programs. And then we did ask each program to state what they felt their strengths and needs were. And so on the top of each box, so UCLA, their strengths were really on the literature reviews, partnering with community-based organizations, and doing an active policy report. But they felt they needed more legislative visit opportunities. And USC felt they needed more family perspective. And the Mind Institute felt we needed more active engagement with a policy brief or some kind of project in that way. So looking at then that information from the LEND programs and moving into, I just wanted to step back again and regroup to the purpose of the LEND program. And so being connected with AUCD and this larger network, the idea is to address national issues of importance to children with special healthcare needs and their families. And so the vision of the LEND programs is that we have kind of these 4 core training areas of information, experience, practice, and research that then lead to, when we leave the program, to be able to be leaders to support systems change in this way. So looking towards that vision to the end of the program, but it was also became very apparent throughout that AUCD has a hard line because of funding, that as LEND trainees, there's a difference between personal advocacy and this policy education. And so we have to be really careful that when we look at a policy advocacy curriculum, that we're not turning into individual lobbyists or groups within this training program. That the goal is to really provide education for our representatives and legislators, to educate them in the way that they can then make good decisions about how their policies affect individuals. So there is that differentiation there that we needed to really draw out before we could move forward. So then looking at the Family Voices of California Project Leadership curriculum, these are the main topics covered in that curriculum. And so comparing the various LEND programs and what training is currently offered and what is missing, we really highlighted that the legislative system and communication piece is really well covered in LEND. And so that is a piece of this curriculum that is currently in the LEND programs. And then I identified the areas of need that really weren't covered very well across LEND programs. And so the areas in red I really wanted to call out as the biggest areas of need that are not currently existing, and that was really the collaboration and advocacy with community-based organizations and really connecting to the community, and then the background and history of disability rights, with the intent again about this, the goal of AUCD and LEND is to is in the ethical implications of why we're doing this. And then the areas in orange are the areas that we kind of cover in LEND training, but not as in-depth as other areas. So as far as next steps, again, just recalling the goal of the AUCD and the LEND programs to improve the health of children with disabilities, to address national issues of importance to children and their families, to advance policy and practice for and with individuals. So I really just wanted to call out that, again, in the mission essentially of our program, that it is to do this with self-advocates, with their families, with their communities, and really the ethical implications of who is being impacted by these policies. And that is why I called out that disability history, rights history, and the collaboration with community-based organizations should be definitely a big need that needs to be fulfilled there.